It is certainly a great day here at WTOC as I get a chance to introduce Ms. Gwen Skinner with the Devereaux Advanced Behavioral Health. You are the Vice President of Operations. Thank you for being here.
Thank you for asking me.
In this area, we're not familiar with Devereaux, but you all have certainly been around for a long time working with foster children and families.
We have. In Georgia specifically, we've been here more than 25 years doing foster care.
Tell me about just the need for foster care and families. Kids have really been through a lot of trauma by the time they finally reach a happy, loving home.
They have, and to give you perspective, in Georgia there are more than 10,000 children in foster care. And so there's also those children that are waiting for their foster care placement, and they can be waiting in various places. The need for foster care is that without those services, then your Department of Family and Children Services is somewhat stuck. So they're dependent upon the generosity of families and the care and concern of families. Our hope is, with Devereaux being in Savannah, is that we will find Savannah families for Savannah's children.
That's wonderful. And it can be in a setting that they're familiar with, a town that they're familiar with. And also, if they're reunited with their families, they may have some contact with them as well.
Yes, it's always our hope. Our first hope for every child is that they can be reunited with their families. But for those that don't, there's also opportunities within the foster care system to adopt. And we have had many foster families who have adopted children.
If you said right now to the people who are watching, what do you need them to do in order to help these children? Because they've certainly been through a lot.
I think first to recognize that they have been through a lot. And I think foster care in some regards has gotten a bad name. You have to recognize that if they are in the child welfare system, there's been trauma in their lives. They have experienced being removed from their families. That could be a negative or a positive. They may have experienced deprivation, food. We find so many of them have experienced food deprivation, physical abuse, parents who have not sent their children to school, poverty, and child abuse is no respecter of economics. So I would never want to give the impression that every child that comes through the child welfare system comes from a poverty-stricken family. It simply isn't true.
So much that they've been through. So I would think that the word to the people who are thinking about fostering is to be patient and to just be gentle with these beautiful souls that are coming into their homes.
Yes, yes. To be patient. We have had foster families, you meet some remarkable people, and we have had foster families that have had up to 6 children in their home. It would take 6 children if you were your own parent of 6 children, it would take an enormous amount of patience. To bring in 6 children that are not your own, those are remarkable adults and parents.
So what kind of training do you all offer for the families who are interested?
Well, the Georgia Department or Division of Family and Children Services requires a certain amount of training before you can even become a foster
that's
parent.
Wonderful to hear.
But it's very reasonable, and it's very geared towards the practical aspects of parenting. So it's not like taking a college course. It's more like the practical aspects of parenting. And then Devereaux goes beyond that and has certain things that we require of our foster parents that we think increase the quality, like we do a great deal of training on trauma.
So, there's someone who's watching right now who has been touched by what you've said about these young people. How long would it take for them to typically be approved to have a child in their homes?
Well, it depends. It depends on what their background is. If you assume that everything is in order, you're going to have to go through the training. So It probably is going to take you 6 weeks, 8 weeks to make it through that process.
That's really not a long time.
Right.
So if I came there and I got through all these processes and I wanted to foster a child in hopes of adopting this child, is there like we see movies and we see where the children are there and there's this one child who connects with the family, or do you know this is the person who you need to assign right away? How does it go? I'm trying to find out the process of all of this.
Well, there's a matching process where the family gets to preview the information about the child. So no one just comes up and says, you're a foster parent, you said you would take children between 6 and 12. Here's one. It doesn't work like that. They go through a matching process to be sure that it's a good fit, because we try to recognize cultural differences. Keeping children close to their home and community is always our focus whenever that is possible, but it's really about the fit with the family.